Turning to the pandemic now, COVID cases are on the rise and stats may be even higher than reported because people who use home tests are unlikely to alert health officials to those results. So what should you do if you test positive on a home kit? Our Jessica Formoso joins us now with advice from the experts. Jessica.
Good evening, Lori. If you are over the age of 65 or have a pre-existing condition and do test positive with a rapid at-home test, you want to contact your doctor, especially if you want or need to be treated with any of the antiviral medication. That said, regardless of your condition, the first thing you need to do is simple. Just isolate.
COVID cases are on the rise. We are currently battling 2 subvariants, and although they do not appear to cause severe illness, they are more transmissible.
As we're seeing cases increase, I think we should all assume that those case numbers are significantly higher than what we're seeing, because right now, only those clinic-based PCR tests are what get counted in the state numbers.
That's in part due to the increase in use of self-tests. There is no database to report a positive at-home result, and there isn't any requirement for people to report it to their healthcare provider or local public health departments.
For most people, if you test positive at home, you're positive, so you don't need to necessarily confirm that. You're going to isolate.
What would you do if you took an at-home rapid test and tested positive?
I would stay at home and I would notify the person that I'm working for.
You should probably tell people too. Yeah, people that you interacted with.
Dr. Stephanie Silvera, who is an epidemiologist, says you must isolate for at least 5 days, regardless of your vaccination status. On day 6, she recommends you retest right at home, no PCR needed.
Those rapid antigen tests are actually a really good measure to determine whether or not you should be out and about with others, because if they are still showing up as positive, that means you still have active virus, and that means you can continue to spread it even after those 5 days of isolation.
As to what to do if someone in your household tests positive, well, according to CDC guidelines, if you are fully vaccinated, you don't need to isolate. However,
you absolutely should be wearing a mask when you go out.
And you should wear that mask because even if you have no symptoms at the time, odds are that you've already been exposed and you will likely test positive in the coming days. Another thing to keep in mind is when you test at home is that test can tell you if you are carrying a high viral load. The darker the line, or if that positive line shows up quickly, that means you have a high viral load. Lori?
All right, good to know. Thank you, Jessica.